This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today, we're looking at a fascinating new study from the Child's Nervous System Journal, published in 2026. It's a Nordic survey on practice of neurosurgical management of craniopharyngioma in children.
This is a particularly relevant topic for our audience of residents and practicing surgeons because childhood onset craniopharyngioma, or CP, represents one of the most challenging pathologies we face. It's histologically benign, but as the paper notes, it has a tendency toward aggressive growth into critical neurostructures.
Exactly. And because it's so rare, the authors cite an incidence of only 0.5 to 2.5 new cases per million inhabitants per year. Maintaining surgical proficiency and standardized care is difficult. This study specifically looked at how 5 Nordic countries, Denmark, Finland, Iceland, Norway, and Sweden, handle these cases.
What's interesting about the Nordic context is that while they have a combined population of about 28.3 million, their healthcare systems are quite similar. They have universal access and high-quality national health registries. This makes it a perfect laboratory to see how different centers approach the same rare disease. Alara, walk us through the methodology of this survey.
The study was born out of the Nordic Pediatric Neurosurgical Network, which is an informal forum for exchanging ideas. A working group of 4 pediatric neurosurgeons developed a 28-question survey. They sent it to all 21 academic neurosurgical centers in those 5 countries. They actually got a great response rate, 86%, with 18 centers participating.
That's a very high response rate for a surgical survey. What did they find regarding organization and expertise?
This is where it gets eye-opening. The primary referral areas for these centers vary wildly, from 0.45 million to 3.2 million people. But look at the case volumes. In 67% of the responding centers, they only see 0 to 1 new case of pediatric craniopharyngioma per year.
0 to 1. That is incredibly low. If you're a resident in one of those programs, you might only see a handful of these cases in your entire training.
Precisely. Even over a 20-year period, from 2004 to 2023, the median number of pediatric CP cases treated per center was only 17.5. That's less than 1 a year on average.
And did the study look at who is actually doing these surgeries? Is it dedicated pediatric neurosurgeons or generalists?
The survey found that a dedicated pediatric neurosurgeon was available in 83% of the centers, usually with a median of 3 subspecialists per department. However, only 22% of centers reported that these cases are exclusively managed by pediatric neurosurgeons. In many places, it's a collaboration between pediatric and adult neurosurgeons, especially for the actual surgery.
That's a common model, especially when utilizing endoscopic endonasal approaches, which often require a specific skill set. Now, what about centralization? With such low volumes, you would expect the countries to centralize these cases to 1 or 2 high-volume centers.
You would think so, but the study found that only Denmark has centralized the neurosurgical treatment of pediatric CP to 1 single center. In the other 4 countries, management remains decentralized across multiple academic hospitals. This is a major point of discussion in the paper. The authors explore whether centralization should be restricted just to the surgery itself or include the entire complete management of the child.
That's a critical distinction. Craniopharyngioma isn't just about the time in the OR, it's about the endocrinology, the ophthalmology, and the long-term follow-up. Speaking of management, did the survey look at how these centers make their treatment decisions?
Yes, and there was one very positive universal finding. 100% of the responding centers discuss all cases in a multidisciplinary team, or MDT, meeting both before surgery and during follow-up.
That's excellent. It shows that even in low-volume centers, the standard of multidisciplinary care is being upheld. But I imagine the specific strategies discussed in those MDTs varied.
Substantially. The paper highlights that while everyone is using MDTs, the surgical indications, goals, and specific approaches vary. Over the last 2 decades, there has been a general trend towards less aggressive surgical approaches in children. The goal has shifted to reducing the morbidity related to treatment, specifically the risks associated with radical surgical resections.
This is the morbidity versus resection debate that defines modern CP management. In the past, the gold standard was often gross total resection at any cost, but the paper mentions that this often leads to significant morbidity.
Right. The authors state that the choice of optimal treatment strategy is difficult because of the risks to critical neural structures. Because of these risks, many centers now opt for subtotal resection followed by adjuvant therapy, like proton beam radiation, rather than pushing for a radical GTR that might damage the hypothalamus.
Did the survey capture specific data on surgical approaches, like transcranial versus endoscopic endonasal?
The survey noted that management strategies, including the surgical approaches, vary among centers. While the paper doesn't give a percentage breakdown for every single center's approach preference, it emphasizes that these differences in practice can confound the comparison of treatment outcomes across different series.
That's a vital point for researchers. If every center is doing slightly different, it's hard to look at a Nordic outcome and draw a single conclusion. Alara, what did the paper conclude about the future of management in these countries?
The authors concluded that practice is characterized by relatively low case volumes and differing strategies. They suggest that the Nordic survey provides useful insights even for those outside the Nordics. The most important takeaway is the embedded discussion on centralization. They argue that given the rarity and complexity, there's a strong argument for centralizing care to ensure that the surgeons and the MDT maintain a high enough volume to handle the complexities.
It's a tough balance. Centralization can be difficult for families who have to travel long distances, but for a tumor that is this rare and this high stakes, having a dedicated team that sees 5 cases a year instead of 0 to 1 could make a massive difference in patient outcomes.
Exactly. And the paper notes that the small populations of these countries, even combined, make this a persistent challenge. When 61% of centers are seeing 1 or fewer cases a year, the learning curve is effectively permanent.
Let's talk about the follow-up. What did the survey say about how these children are monitored long-term?
All centers reported follow-up routines, and again, these are discussed in MDTs. Because of the stable populations and the unique identification numbers in Nordic countries, their follow-up is generally very good. This allows them to track the long-term morbidity, which is so crucial in CP.
For our listeners who are residents, if you were to summarize the standard Nordic approach based on this survey, what would it be?
I'd say there isn't one single standard, and that's the point of the paper. It's a transition period. We see a shift towards less aggressive surgery to protect the hypothalamus, a universal reliance on MDTs, but a lingering fragmentation of care in 4 out of the 5 countries. If you're in Denmark, you're going to one center. If you're in Sweden or Finland, you might be at one of several.
It's a call to action for more collaboration. The Nordic Pediatric Neurosurgical Network was the catalyst for this. It suggests that if you can't centralize physically, you must at least centralize your data and your decision-making protocols.
And the paper explicitly mentions that these results are relevant globally. Many regions in the US or Europe might face similar low-volume issues at individual centers. The Nordic model of universal MDTs is something everyone should be striving for, regardless of their day's volume.
Well, this has been a great dive into the current state of pediatric CP management. It's a reminder that sometimes the most important surgical skill is knowing when not to be aggressive and ensuring you're part of a robust multidisciplinary team.
Absolutely. The paper is Nordic Survey on Practice of Neurosurgical Management of Craniopharyngioma in Children, and it's a must-read for anyone interested in pediatric neurosurgery or healthcare organization.
Thank you, Dr. Alara, and thank you all for listening to the Neurosurgery Hub podcast. We'll see you in the next episode.
See you then.